I am Dr. Natesh, Senior Consultant and Professor of Orthopedics, Virinche Hospital, Banjara Hills. So today I am here to explain about uh, meniscal injuries, which are categorized under sports injuries. And most of the people do sustain meniscal injuries, but they fail to identify the exact reason. And meniscal injuries neglected will cause cartilage damage, and that will be a prolonged injury. And those patients will have early degenerative changes, maybe at around 40-45 years of age, rather than at 60 years of age, which happens due to senile osteoarthritis. So this is the model of a knee joint. This is the patella, this is the thigh bone, and this is the leg bone. So once the patella is moved apart, we can see there will be two C-shaped washer-like structures here between the thigh bone and the leg bone. And the function of these structures is to absorb any shocks and to protect the cartilage over the thigh bone and as well as on the leg bone. And these C-shaped structures are called meniscus. One is middle meniscus, the other one is the lateral meniscus. This is outside and this is the inner side. And when there is any twisting injury, or when suddenly the patient is walking while running suddenly, or halting suddenly, or standing up in an abnormal position because of some abnormal loading of the knee joint, then there is a chance of tear of these meniscus, or landing in an abnormal way after jumping while playing, or jumping a wall, or jumping some pitch. It's these meniscus are prone to injury, and once they are injured, depending upon the place where they are injured, there can be pain while squatting completely in this position, like we use the Indian toilet, or like we sit squatting in a temple or in front of while praying. There may be pain in the knee joint. The pain may be very mild initially to start with. If the patient is having pain while complete extension of the knee joint, there may be an injury on the anterior aspect of the meniscus. And also the pain may vary from a mild pain in the knee joint to start with, and it can even vary for and it can be very severe, as to there may be locking sensation in the knee joint. The patient may not be able to move the knee joint also. That happens when the tear advances and it becomes a full bucket handle tear. The part of the meniscus will be bucket handled into the knee joint. There will be a tear in this fashion, and it will be the displaced into the knee joint, because the anteriorly and posteriorly it will be attached into the root of the meniscus, and the torn part may bucket handle into the knee joint. That will cause locking of the knee joint. In such cases, it will be very severe, and the treatment usually, for minor tears, we can treat it conservatively with some exercises as well as some pharmaceuticals, but nutraceuticals as well. But major tears like bucket handle tear, or complete tear or root tear of the meniscus, it requires arthroscopic surgery. We don't have to open the knee joint, but we have to go inside the knee joint with the help of a camera, and we have to identify the tear, and we have to either repair it, or we have to balance it with the other side if the tear is in multiple planes and it's in a very advanced stage. So in bucket handle tears, we have to reduce the bucket handle and we have to suture it. So these are the treatment options that are available. And in case I advise all people who are physically active in sports to do proper exercises and proper warm up before getting into the field. And in case if you feel that there is a meniscal injury, there is a vague nagging pain in your knee joint, better consult your orthopedic surgeon, who will usually get a MRI scan done, because the meniscus is not visible on an X-ray. So based on MRI scan, your respective doctor will treat you, and stay healthy, do regular exercises, and get it treated or attended to by an orthopedic surgeon as early as possible, so that you can avoid the late complications of meniscal tears like osteoarthritis. Thank you very much.